In 1964, the Surgeon General condemned smoking for the first time. Since then, there has been a decline in smoking. Even though the population is aware of the negative effects of smoking, in the United States, 1 in 5 adults use tobacco regularly. Historically, most adult smokers started the habit when they were teenagers. Therefore, developing remediation programs for teenagers could be the most effective measure to lower usage rates in the United States. The Not on Tobacco (NOT) program aims to help teens stop smoking by empowering them with the knowledge and skills to quit. The efficacy of the NOT program will be examined and will be compared to standard intervention programs. The NOT program consists of 10 15-minute group discussions where teens can learn and talk about smoking cessation in a safe space. After the course is over, participants can attend up to 4 additional meetings to help reinforce their sobriety. The NOT groups are gender specific and have a facilitator that is of the same sex as the rest of the group. This structure allows the group to focus on issues specific to their gender. No more than 10 to 12 teens are part of any group, so that everybody in the group has the chance to be heard. The NOT program teaches facilitators to lead the discussion on a level that is age appropriate, using teen-friendly language that is more relatable. The topics covered in the NOT program includes finding motivation to quit, healthy management of stress, the physiological and psychological effects of smoking, preparation to quit, and relapse prevention. The program focuses on social aspects of smoking too: coping with peer pressure, awareness of smoking in culture and media, identifying their support systems, and how to live a healthy tobacco-free lifestyle. The NOT program includes diet changes and physical activity, which both contribute to the success of quitting. Of the myriad of factors that will contribute to a teen's original tobacco use and the subsequent success or failure in quitting smoking, at least 4 are out of the teen's control. Geography is a major determinant in the likelihood of tobacco use and successfully quitting. Smoking rates are much higher in rural areas than in urban areas. Low socioeconomic status is another large risk for tobacco use. Born into homes of low-income parents, these teens pick up the habits of their less educated parents. Genetics are the least controllable factor in smoking risk. Certain polymorphisms can be major determinants for tobacco and drug use. If attendees of the NOT program have certain genetic makeup, then they will have a much harder time quitting on a physiological level. There is a strong connection between mental health and drug use, such as tobacco. Untreated mental health problems make it more challenging to quit smoking. These 4 risk factors can't be changed in teens and add great difficulties in quitting. Not all environmental factors in a teenager's smoking habits are out of their control. The support network of the target audience greatly impacts a teenager's success in quitting. If the teen's family and friends who smoke, the teen will have a hard time finding the emotional support needed to stop. Peer pressure is profoundly influential over teen behavior. Stress is an important driver in human emotion and action. If teen smokers have stress from poverty, domestic abuse, or romantic relationships, they will have a harder time quitting. Finally, the desire to quit is a factor in tobacco cessation. If the teenager lacks the desire to quit, then it is unlikely that they will. The Not on Tobacco program was created to be adjustable so it could impact the most teens as possible. The NOT program has been used in 48 states. Throughout such a vast geographical area, the socioeconomic and cultural differences of the population are large. The Not on Tobacco program has an adaptable curriculum to help connect with different populations in a more targeted way to which teens in specific regions can relate. The NOT program also changes according to social norms and values in the communities. By identifying the differences between urban and rural teens, the facilitators can effectively empower the teens to quit. In areas where tobacco is farmed, such as Virginia, Kentucky, and Tennessee, smoking plays an important role in the local economy. If the families of teens rely on tobacco to make a living, then they will have a different outlook on it than someone, for example, a northern city like Boston. The program separates teens by gender. This allows for facilitators to focus on issues that the teens really connect with. Males and females are held to different standards in society, so by separating them, the facilitators can address specific concerns. Girls aren't concerned with remaining masculine, and boys won't be concerned with smoking while pregnant. With the growing number of Spanish speakers in the country, the NOT program has been translated so it can reach more teens. The Not on Tobacco program is the result of a collaboration by 4 separate organizations: the West Virginia University Centers for Public Health Research, the West Virginia State Health and Education Departments, the Coalition for a Tobacco-Free West Virginia, and the American Lung Association. Several professionals played a role in Beyond Reach and Effectiveness and Appalachian Teen Smokers. Kimberly Horn and Jerry Dino are involved with both studies. Kimberly Horn is an associate dean at the George Washington University and has a master's in social work and a doctorate in education. Jerry Dino uses her PhD as a professor and director at West Virginia University. In Appalachian Teen Smokers, Kimberly Horn was the principal investigator and Jerry Dino was a co-investigator. Steve Sussman, Tim McGloin, A.W. Fernandez, and Heidi Kalasekar were integral parts of the study. In Beyond Reach and Effectiveness, Andrew Ansetti Rothermel, Master of Public Health, and N. Noichmatu, Master of Science and PhD, were primary investigators, and Kimberly Horn and Jerry Dino were involved in lesser roles. The team was made up of investigators with PhDs, doctorates of education, masters of public health, and social work. All the main investigators are academics, but the areas of expertise differ. The varying focuses help to connect the social aspects of teen smoking to the statistics and health effects associated with them. Given the high rate of first-time tobacco use in the teenage population, there are many stakeholders who have focused resources to countering teenage smoking. Some of these stakeholders have been instrumental in the development of the Not on Tobacco program. For example, the Center of Disease Control provided financial support through the Prevention Research Centers for research leading to this program's inception. The American Lung Association oversees the Not on Tobacco program on a national level. Having invested heavily in the program, the ALA wants proof that the Not on Tobacco program is more effective than conventional intervention programs so they can spread the program around the nation and lower smoking rates. The Coalition for a Tobacco-Free West Virginia helped start the Not on Tobacco program, and they are obviously trying to reduce smoking rates as well. The government has a large interest in reducing the number of smokers so that it will save lives and lower the burden on the taxpayer. Smoking burdens Medicaid and Medicare with recipients that have preventable diseases at about $170 billion per year. Healthcare professionals are invested in reducing smoking rates because it would free up time and resources if smoking populations decreased. Family and friends of smokers are involved because of emotional and financial reasons. The Not on Tobacco program is funded by the government with support from the communities that the program takes place in. The West Virginia University Prevention Research Center is a member of the Research Centers program, which has financial support from the CDC. Both studies received funding from the Prevention Research Center of West Virginia University. Beyond Reach and Effectiveness received additional funding from the West Virginia Bureau for Public Health, Division of Tobacco Prevention. The communities that were involved with these studies needed to provide a space for the group to meet. The Not on Tobacco program requires facilitators, so the community needed to be willing to recruit adults who completed the Not on Tobacco training and lead discussions during meetings. Journaling is an important part of the Not on Tobacco program, so schools had to make sure that students had paper, notebooks, writing utensils, and printouts of the Not literature. A program that tries to help teens quit smoking has very few ethical concerns. During the studies to prove the effectiveness of the Not on Tobacco program, the control groups received standard, brief interventions. For science, these teens were not given adequate services, which led to a lesser success rate. Some groups may argue that taxpayers should not be spending money on a tobacco cessation program. It is the teens' conscious decision to start smoking, so why should non-smokers be held financially responsible for the choices of others? Some may argue that the government should not be funding a program that forces teens to change the way they think. The Not on Tobacco program is strictly voluntary. Teens under 18 are breaking the law by using tobacco. Critics could think this in some way enables the teens, even though it is meant for them to quit. The tobacco industry is probably the largest opponent of the Not on Tobacco program. Recruiting new smokers is essential for maintaining steady incomes for tobacco companies. Pharmaceutical companies that make tobacco cessation products could be opposed to the Not on Tobacco program because it is an alternative way to quit smoking. Adult smokers attempt to quit every 2 to 3 years and usually fail. Pharmaceutical companies that make nicotine patches and nicotine gum and anti-tobacco drugs profit from each of these attempts to quit. If teen smokers quit early, then they will never need to buy products that would help them quit. Other smoking cessation programs may critique the Not program because there is competition for funding. There is a myriad of factors that contributed to the absolute necessity of this program. Most adult smokers began using when they were in their teens. People with a low socioeconomic status are more likely to smoke than people of high socioeconomic status. People in rural areas are more likely to smoke than people in urban and suburban areas. The Not on Tobacco program is tailored to be used in different regions. To address the specific concerns of each community, the Not on Tobacco program educates teens on ways to live a healthy lifestyle and how to face issues that adolescents experience. Financially, the Not on Tobacco program is cheaper than medical expenses for COPD or heart disease. The U.S. healthcare system is burdened by the resources used to treat people who smoke, so if teens stopped early in life, they could avoid the chronic diseases. People of low socioeconomic status have less disposable income, and tobacco use is an expensive habit. Tobacco users could save a lot of money if they didn't purchase tobacco or have the additional healthcare spending. The legal age of tobacco is 18. It doesn't look good for any state to have high rates of teen smoking. It is illegal for minors to be smoking, so there is a political and legal drive for communities to stop teen tobacco use. The Not on Tobacco program is voluntary, so teens will face no legal problems for seeking help in the group. The Not on Tobacco program is largely successful because of the malleability of the curriculum. Throughout the country, there are large social and economic differences that alter the citizens' lives and impacts the resources for smoking. The Not on Tobacco program is changed to fit the issues that teens in specific communities see. The program recognizes important factors that contribute to teen tobacco use, and they address it. The Not on Tobacco program's 10 meetings are far more effective than a singular meeting that many schools offer. If the teens are struggling with their sobriety, there are additional 4 booster classes available. This gives the teens a safety net and a support group to lean on. Quitting tobacco is a hard task. It takes time to stop. The facilitators educate the teens on health, diet, and exercise. Teens may not know what they are doing to their bodies when they smoke, so facilitators teach them how to be healthy. The NOT program uses journals, group discussion, and experimental activities to make the meetings more interactive. teenagers are easily distracted, so multiple activities that require